Why do OAB symptoms occur? Have you ever wondered why some people experience sudden urges to urinate, even when their bladder isn't full? This phenomenon is known as overactive bladder, or OAB. OAB symptoms occur primarily due to involuntary contractions of the bladder muscle, which is called the Detrusor muscle. These contractions happen even when the bladder is not full, leading to a strong and often uncontrollable urge to urinate. The normal function of the bladder relies on a well-coordinated interaction between the bladder muscle, the nerves that signal fullness to the brain, and the brain's control over the bladder. When this coordination is disrupted, OAB symptoms can arise. Several factors can contribute to these symptoms. Neurological factors play a significant role. Conditions like stroke, multiple sclerosis, Parkinson's disease, spinal cord injury, or diabetic neuropathy can interfere with the nerve signals between the bladder and the brain. This disruption can cause the bladder to contract inappropriately, resulting in urgency and frequency of urination. Another reason for OAB symptoms is muscle overactivity. The detrusor muscle can become overly sensitive or spontaneously active, contracting without the usual triggers. This may happen due to changes in the sensitivity of the muscle or the nerve receptors. Bladder outlet obstruction is another contributing factor. Conditions such as an enlarged prostate or pelvic organ prolapse can block urine flow. This blockage can lead to incomplete emptying and increased pressure in the bladder, stimulating overactivity. Bladder irritants and infections can also provoke OAB symptoms. Urinary tract infections, bladder stones, or tumors can irritate the bladder lining, causing urgency and frequency. Lifestyle choices can exacerbate OAB symptoms as well. Excessive fluid intake, caffeine consumption, smoking, constipation, and certain medications, like diuretics, can all contribute to increased urgency. Hormonal changes and aging can affect bladder function too. For instance, menopause can impact nerve control, increasing the risk of OAB symptoms. Several theories explain the underlying mechanisms of OAB. The neurogenic theory suggests that reduced inhibitory nerve signals and increased sensory signals from the bladder trigger premature voiding reflexes. The myogenic theory focuses on increased sensitivity and spontaneous activity of the bladder muscle itself. The autonomous bladder theory points to abnormal muscle activity driven by specific receptors. Lastly, the afferent signaling theory highlights increased sensory nerve activity during bladder filling, leading to heightened awareness of urgency. In some cases, the exact cause of OAB symptoms remains unknown. It's also important to note that bladder tumors can cause symptoms similar to OAB, such as urgency and frequency. Therefore, if you experience persistent or worsening symptoms, it is crucial to seek medical evaluation to rule out serious conditions, including bladder cancer. Managing OAB often involves addressing underlying causes when possible, making lifestyle modifications, bladder training, pelvic floor exercises, medications, and, in some cases, advanced therapies like nerve stimulation or surgery. Consulting a healthcare professional is essential for accurate diagnosis and appropriate treatment. In summary, OAB symptoms occur due to involuntary bladder muscle contractions triggered by nerve or muscle dysfunction, bladder irritation, obstruction, or other contributing factors. Understanding these causes can help in managing the condition effectively.